Hello everyone, so welcome back. Now we will be checking part 5 technical round interview questions. So before entering into the video, if you haven't watched the previous technical round questions, please do check my playlist so that you will have a proper continuation of the questions, and please make sure you're writing all those questions and keep it in your book so that it will be really helpful for you while practicing. So first question, what is the rule for low birth weight coding? In ICD-10-CM, low birth weight is classified based on the newborn's weight at birth. For a baby with low birth weight, you would use codes from P07.0 to 0.3 series depending upon the weight of the baby. Second question, how do you code congenital heart defects? Congenital heart defects are coded under Q20 to Q28 range. Each code in this range corresponds to different type of congenital malformation affecting the heart, its valves, septa or great arteries. It's important to ensure that the specific defect is identified to select the most appropriate code. Third question, when do you code symptoms instead of a diagnosis? In medical coding, symptoms should be coded when a definitive diagnosis has not been established or if the symptoms are the primary reason for the patient visit. For example, if a patient presents with a chest pain but no specific diagnosis like angina or myocardial infarction has been determined, you would code for the chest pain, that is symptomatic pain. Fourth question, how do you code a burn injury? When coding for burn injuries, the first step is to determine the severity, the degree of the burn, whether it is first degree, second degree or third degree, and then you should know the location of the burn, and then you should know the extent, that is the total percentage of body area affected. Additionally, if the burn is associated with any complications such as infection, that should be coded. Fifth question, what is the difference between adverse effect and poisoning? The main difference is adverse effect is when a patient experiences a harmful or unintended reaction to a drug or substance that was properly prescribed or administered. Poisoning refers to a harmful effect caused by the excessive dosage of a substance, whether it is intentional or unintentional. Both are coded from T series. Sixth question, how do you code external cause codes? External cause codes are used to provide additional information about the cause, intent and place of occurrence of an injury or health condition. These codes are found in V00 to Y99 range. External cause codes are also used to indicate factors like intent, the activity and the place of occurrence. Are external cause codes mandatory? External cause codes are not always mandatory, but they are required when coding for injuries, poisoning and other conditions caused by external factors. For example, if a patient has a fracture resulting from a fall, the external cause code explains the fall. Similarly, if the patient is diagnosed with poisoning, the external cause code will explain how it has happened. Eighth question, when do you use Z codes? Z codes are used in ICD-10 to capture non-disease or non-injury related factors that may influence a patient's health or their interaction with healthcare services. These codes are used for a variety of reasons: preventive care, family history, social factors, counseling, and so on. So I'm not explaining the definition here. While watching the video, you can make a note of it and keep, so that it will be helpful for you to understand like for what all things it is used, and you will have a proper idea. What is a guideline for status codes like is it 79.4 or is it 85.3? It mainly describes the treatment that are not currently active but still affect the patient's health status. That is what the definition for that, and example is given below. Please watch it. And that's all about this question. Thank you so much for watching, and if you are looking for placement assistance training, you can just register with us. We are there to help you. Thank you so much for watching this video, and if you haven't subscribed, please do subscribe, and if you find it useful, please do share it with your friends also. Take care.